Respiratory Therapy, class of 2013, I would like to welcome the faculty, family, and friends that came out to support us today. Without all of you, most of us would not be standing where we are right now. I would also like to thank all of the local hospitals and their staff for their continued support of this unique program and our students. 2 years ago, there were 32 strangers in a room wondering what respiratory therapy entailed and what they had gotten themselves into. This group, at first glance, had very little in common, ranging from those fresh out of high school to those looking for a second or third change in careers. There was one thing in common, which was we were all interested in exploring this thing called respiratory therapy. We began the first semester knowing nothing and had pages of equations thrown at us. We were tested on 25 different medications, many of which we still haven't heard of or used since that test. What we did learn that first semester was the basics of respiratory care and how important the lungs and heart are to our survival. After months of nonstop exams, first semester came to an end. They refused to give us a break, and before our second semester, they required us to spend winter break as the only students on campus. Soon started second semester, where we put our knowledge to work in the hospital for the first time. For many, treating their first few patients was as uncomfortable as any experience they could remember. I always wondered if I was the only student who went right home and took a shower the day after going into my first isolation room. In this last year, every day became more comfortable, and we began to feel as if we were actually making a difference in the hospital. Respiratory therapists and nurses began to communicate with us, and some even believed what we had to say about our patients. Well, minus the nurses. In school, we continued to dig our noses into textbooks, wondering if Donna's next exam would be as difficult as she threatened it to be. The months passed, and going to clinical began to feel less like schooling and more like a career. We began to recognize the respiratory therapist's role in the hospital, and with each shift, our responsibilities became greater. For the last 2 years, we have had to make sacrifices and put off other plans because of upcoming exams and 4 a.m. wake-up calls. For those of you with children, I can't imagine all of the family time missed and members of events sacrificed just so you could get to where you are standing today. After all the attempts that Lisa and Donna made to prevent us from graduating, we have finally made it. While we may have lost a few along the way, we've also gained a few and become stronger as a group. 2 years of hard work leaves us at this intersection where many of us will be traveling in all different directions for new opportunities. Just as quickly as we became a class, we will disband and start a new chapter of our lives. Before I end, I wanted to tell a story about how even the smallest, simplest task at work can make a big difference to someone else. 2 weeks ago, I treated a 5-year-old girl that was hospitalized after an asthma attack. The only time I treated her that night was at 4 a.m., and she only partially woke up for the treatment. I explained that my name was Daniel, and I was there to give her a breathing treatment. 8 nights later, I came to the hospital, and she was on my patient list once again. I went in and saw her during first rounds and said, "Hi, I'm back to give you another breathing treatment. How have you been doing for the last week? Do you remember me?" She said, "Your name's Daniel," as if I was stupid for asking. 3 hours later, I was walking down the hall on the other side of the hospital when I crossed paths with the same girl and her nurse. The girl said she had made some artwork for me that she had been working on all evening, and they had been walking around the hospital looking for me. The nurse later told me that she was happy that the girl wanted to walk around the hospital as she had been bedbound most of the last 9 days and they were working on her regaining her strength. I took my gift and said thank you before parting ways. This was the last time I saw her before she was discharged home from the hospital, but it was so rewarding that something so small and even the simplest task can make such a difference to somebody's day, hospital stay, or life. So to my fellow graduates, I encourage you to always do your best, even with the simplest of tasks, because you never know when it will make someone's day a little bit brighter. Congratulations again to the class of 2013, and good luck to all of you. Thank you.